Good to go?
Awesome. So I want to thank you all for being here today to learn a little bit about suicide, how to recognize the signs, and what to do when you do recognize those signs. This talk is called Small Talk Saves Lives. And my name is Breanne. I work at the Canadian Mental Health Association. I'm the Suicide Prevention Program Coordinator. I've been with the organization for 7 years. I've done this role for 2. So I've also worked in various roles within the organization, including Housing First Outreach and community helpers. So I have kind of a lot of practical knowledge as well as educational knowledge about suicide. And hopefully after today, you will have some of that knowledge too. Haha, there we go. We really need to understand why it's important that we do talk about suicide. Really reduce that stigma by talking about it. It's only by opening ourselves up to having these conversations that we can let people know that yes, it is okay to talk about this. Suicide absolutely does affect every single one of us. Even if we don't know somebody personally who has died by suicide or who has thought about suicide in their life, we can all at least name one person anywhere in the world who we know of who has been impacted by suicide. I love when I say that because people always look at me like, no, and I go, do you know who Robin Williams is? Because if you know that name, then you have been impacted by suicide in some way. We always say that even one death to suicide is absolutely too many deaths. We believe that the more people are educated and understand and are open to having these conversations, the more lives we can save. Suicide is absolutely preventable as well. If suicide was not preventable, I wouldn't be here. If we just accepted that suicide was going to happen every single time somebody thought about it, my whole role wouldn't have a purpose. So we firmly believe that yes, suicide is preventable, and we can all learn skills in order to help somebody who is thinking about suicide. But in order to understand how suicide actually impacts us, we're going to take a look at some numbers. If we look up there, we look at the population of Alberta in 2019, we see that there was a reported 586 suicides in Alberta in that year. And the next line, though, is kind of an interesting one. Unreported suicides. Those are about 5% to 25% more estimated. The unreported suicide is kind of an interesting kind of thing. An unreported suicide, we may see somebody who died and we don't know what their intention was. Typically things like overdose could fall into an unreported suicide, where we don't know if the intention was to die or if it was simply that they took too much of whatever substance they were taking. Another form of unreported suicide that we don't really ever think about is perhaps a car accident. Was their intention to die, or was it truly an accident? If we take a look at suicide behaviors, we see that those occur at a rate of 40 to 100 times greater than the actual number of suicides. So we're seeing more behaviors than deaths. People impacted. I love this statement. Each suicide may affect a few or a large number because that is perfect and vague, right? Super helpful. But it's true. It depends on who that person was, what their connections to their community were, what their family was. So when we're looking at a core group of people, we can say, yes, it impacts just their immediate family, but beyond that, it can spread to impact a whole community. On average, about 6 people are directly affected by every suicide, but that's just an average. People with thoughts of suicide occur at a rate of 1 in 20. So that's 5% of our population. That's a large number of individuals experiencing thoughts of suicide on a daily basis. Majority of the time, we might not even know these people. But after this, you should hopefully be able to pick them out of a crowd or pick them out of your friends and family and get them the help they need. When we're talking about intervention, we're talking about those people with thoughts of suicide. Those are the ones that we can reach out and help. We're going to play a little bit of facts and myths because I absolutely love breaking down some of the facts and some of the myths around suicide. So, it is absolutely a myth that everybody who dies by suicide gives no warning sign. Sometimes, yes, the death is sudden and unexpected, but often there are warning signs that occur. Perhaps they've just been missed. Another myth that I absolutely love to break away is that only clinically depressed people think about suicide. The truth really is that anybody at any point in their life can think about suicide. It's not tied to any form of mental health problem. Anybody from any walk of life can think about suicide. Talking about suicide encourages it is another myth. I recently taught a course, and one of the girls in my course who was there learning said, but if we talk about this, aren't we encouraging it? Basically what it says right there, she actually said to me, and I said, absolutely not. Talking about suicide reduces that stigma. It encourages open conversation. And sometimes starting those conversations about suicide can enable people to actually feel comfortable talking about it. I also say that you're never going to put the thought into somebody's head. If they're already thinking about suicide, you're not going to encourage them to think about suicide. They're already there. We just need to connect with them to help them. This is my absolute least favorite thing that people say about suicide. That when somebody talks about suicide, they're just attention seeking. We have got such a negative connotation in our brains when it comes to the term attention seeking. But really, I'm going to tell you that if somebody is displaying what we would call attention seeking behavior, they need attention. There is a purpose behind that behavior. I'm going to give you a different word. Try flipping it in your brain. The term I like to use is attachment seeking. If we remove the attention seeking from the equation and we start looking at behavior and talking about suicide as seeking attachment, that helps us feel a little bit better maybe of what we're seeing and helps us to respond in a much more effective way.
That's very good.
Thank you. I absolutely love that term.
Yeah.
Making that change in my brain was the most helpful thing I think I ever did in my career, was challenging that perception of attention seeking. And of course, I've already gone over this one. Suicide absolutely can be prevented. As I said before, I would not be here if it was not able to be prevented. The truth that we need to understand is that at its core, suicide is about pain. That individual is experiencing a massive amount of pain, mental pain, sometimes even physical pain is part of suicide. Talking to people about suicide is absolutely helpful. People at risk communicate what we call invitations. For those of you who are trained in assist, you know what I mean when I say invitations. For those of you who have never taken assist, by the end of this, you'll know exactly what I'm talking about. Another thing we need to accept if we're going to be effective helpers is that most people who are thinking of suicide actually do want to live, and they will live if we give them help. I like to kind of date myself and quote Jurassic Park at this point, where I say life finds a way. And it really does when we're talking about suicide. We also need to accept that suicide thoughts and behaviors occur in people of all age groups and all walks of life. And when I say all, I mean all. There are now training courses available that I'm actually a facilitator of that talks about suicide in children under the age of 12. We also need to understand that our seniors are impacted by suicide as well. All means all. We also need to have an understanding that suicide and self-harm are two different things. With somebody who's considering suicide, they want the pain to end. That is their end game. They want it to stop. Self-harm is a means of coping with pain. The purpose of self-harm is not to die, it's to cope. What this really means is that suicide is a universal human concern. It affects every single one of us. It's preventable. I'm going to pound that into your heads over the course of this hour because it really is preventable. And it's everyone's business too. We tend to get stuck into our own little worlds where we only focus in on the people that are directly close to us. And with COVID, that's probably a good thing. But if you see somebody struggling, you have the right to talk to that person and get them help, regardless of your relationship to them. It's everyone's business, not just the person closest to them. So now that we kind of understand suicide a little bit, we're going to get into some of the more how to help things. The first thing we need to know is protective factors and risk factors in situations. Having an understanding of these can help us zero in on the people who may need our help, but they are not a definitive list of the only people that will ever need our help. When I'm talking risk factors, I'm really talking about the things that are more likely to cause somebody to think about suicide. So having a previous suicide attempt increases the risk that somebody will try to die by suicide again. Having a family history of suicide also increases the risk. There's a lot of data out there that suggests that suicide can sometimes become a coping mechanism within families, and that can be a learned behavior. Having a mental health disorder. So yes, as I said before, not only mental health related patients will die by suicide, it can be anybody, but having a mental health problem increases that risk. Having access to lethal means increases the risk. And even if you are somebody who is typically safe with things and say perhaps locks your guns away, having them available increases your risk. Substance use also increases that risk. Substances take people out of their brains and into a different kind of mindset. It decreases their inhibitions, which allows them then to act on those thoughts quicker and faster. So now that I've scared you with all of the all of the risk factors, there are things also that protect you from dying by suicide. Having a connectedness with other people, family, and being connected to your community can protect people from dying by suicide. Having really good problem-solving skills, being able to look at a situation and solve that problem in an effective way can decrease that risk. Having adequate care in the community for addictions and mental health issues is also a protective factor. Sense of self-belonging, sense of self-worth, those personal characteristics that make a person a person can also be a protective factor. And spirituality or connection to a religious community. This is not to say that just because somebody doesn't have those that they're at risk, the presence of them just decreases the risk. So if you're not part of a religious community, that doesn't mean that you're at risk of suicide. It's just having that decreases the risk. In order to efficiently help somebody who is thinking of suicide, I'm going to give you a couple acronyms that should hopefully get us through and hopefully clarify some things. Really, we need to walk with that person. WALK stands for warning signs, ask, listen, and keep safe. So when I say you need to walk with them, this is what you need to do with that person. Warning signs really is the first step to recognizing when somebody is thinking about suicide. There's a lot of different signs or invitations for those of you who have taken assist. There's a lot of different things that people can do that tells us when they're in trouble or tells us that suicide might be something that they are thinking about. My second acronym of the day will help us remember those signs. It's SAVE. If we recognize the signs of suicide, we might save a life. So we're looking at stressful situations, actions, verbal, and emotional expressions. Really though, we're looking for a marked change in behavior or distress level. Sometimes it's sudden and dramatic, sometimes it is gradual. Often we see that really quick shift. But it is sometimes more of a gradual, slow process. And when you look at somebody, you think, oh, hey, this is different. And I didn't even notice it until now. It was so quiet until now. That change in behavior and distress level goes both ways. Some individuals might be more extreme in behaviors, others might be more subdued. So take a look at the people you know and see if they're behaving the same way. Is their distress level the same as it was before? Stressful situations is the first in our save. There are certain things that happen in somebody's life that could be a sign that they're thinking about suicide, or could lead to somebody thinking about suicide. The first one I have up here is loss, but we need to understand that everything underneath that is also a form of loss. So rejection, peer rejection, family rejection. We often look at rejection within the LGBTQ2S+ community as a major factor in suicidality. Abuse. So when we're terming that in form of loss, we could look at it and say abuse is a loss of safety. It's a loss of self-autonomy. Previous suicide loss is right in there. Having a past suicide attempt and financial struggles. I know a lot of people in our area, with everything happening with COVID and all the shutdowns and lockdowns and job loss, we are seeing a lot of individuals struggling financially in our communities. And that could be something that could lead somebody to be thinking about suicide. Actions. I absolutely love this GIF on here because it's something that we don't really think about when we think of somebody who is suicidal. We think of things like withdrawing, giving away possessions, having a loss of interest in what's going on around them. We don't ever think of anger, but we should think of anger, because anger is also one of the ways somebody tells us that they're hurting. Having a misuse of alcohol and substances, a lack of interest in appearance. I always say that the first thing I can tell about how somebody is doing before they even open their mouth is based on what they look like. Have they showered? What do they smell like? Have they changed clothing since the last time I saw them? Do they look tired? Are there bags under their eyes? That physical appearance is a clue before they even start talking. Appetite is another one. So some of us tend to eat more when we are stressing out and when we're not feeling well. Some of us don't eat at all. So that fluctuation is what to look for. I'm also going to jump back up to impulsive and reckless behavior. These are things that are out of characteristic for that individual. They include things like the increasing use of substances, but they could also include things like driving recklessly in their car, or drinking and driving, or even impulsive sexual habits with multiple partners and no safety involved. Those are kind of some of the things that we look at when we're talking about impulsive and reckless behavior. V, verbal. All of these things could be the things that you're hearing from them. They might come right out and tell you, I wish I was dead. I don't want to be here anymore. Being here hurts. No one can help me because nobody cares. Can't take it anymore. This is one of the ones I've heard. It's all going to end soon, so what's the point? I won't be needing these anymore, as they're handing you things. Everyone will be better off without me. It's another one I've heard commonly from people who are struggling and believe that they are a burden to their friends and family. The idea that everything would be better off without them. These things are shaded in what I call sadness, fear, and perhaps anger as well. Although I'm going to point out that a lot of these things are things that you might have said at some point in your life without talking about suicide. I know a lot of teens will say things like this without meaning suicide. My best advice for that is to clarify what they mean. Clarify, clarify, clarify. E, emotional expressions. So you might not actually ever get a good feel for what's happening inside somebody else's brain. A lot of these we can only figure out by asking about it. How are you feeling? You might get hopeless, helpless, numb, ashamed, depressed, angry, lost, tired. A lot of individuals who say that they are tired all the time and have been struggling, suicide might be on the table for those people. Really, if you don't know what's going on with their feelings, you can ask. Guaranteed, if they're thinking about suicide, it's any one of these that they've been feeling inside. Sometimes you can see them though. Have you ever seen somebody who just looks sad? That person might be thinking about suicide. So if we've gone through SAVE and we recognize some of those signs in there, because remember, nothing with SAVE is actually a checklist, it's kind of a guideline instead of a set of check boxes you need to fill out. If you notice some of those signs and you think something might be going on with that person, what do? This is where I usually make the joke and say, okay, you're done now, right? You're done. You've noticed it, you're good to go. Only you're not, because that person is still at risk. We need to move on to A, which is probably the hardest question, but yet the most important question you'll ever ask somebody you think is thinking about suicide. And when we use A, which is ask, we are going to ask them in this way. Blunt, to the point, and with crystal clarity. We're going to ask, are you thinking of suicide, or are you thinking about killing yourself? It's not an easy question to ask by any means. Even those of us, like myself, who have asked that question probably hundreds of times over the course of my career, it never gets easier, but it never gets less important either. There are lots of ways that you could ask this question that are not helpful, though. One of the ways already prejudges a person. So if I were to ask somebody who's thinking about suicide, you're not going to do anything stupid, are you? Oh, aside from that feeling bad inside myself, it judges that person and tells them that maybe I don't want to talk to this person about suicide because they already think I'm going to be stupid. Another thing I caution people at is when they're asking this question to not use the word hurt. I've heard it asked a bunch of times like, you're not going to hurt yourself, are you? Hurt doesn't describe what we're looking for. We're looking for death, not hurt. They're two different things. Prior to myself being trained in assist and being in this position, I actually asked somebody once, thinking they were suicidal, you're not thinking about hurting yourself? And he replied to me, no, it's not going to hurt. And I went, okay, wow, what do? I should have asked in this way, because then I would have known right in that moment what we were talking about. So be careful with the words you're using, but be confident that you have the right to ask this question if you think suicide is something that they're thinking about.
How many times would a person lie about that and say no, but they really
They might lie over and over and over again, and they might say no, no, no. If you keep getting a no and you think it's actually a yes, my advice, in my experience, is to get emergency services involved. If that person is unwilling to work with you, definitely reach out to those 24-hour supports and perhaps even call crisis teams in. A majority of the time, though, I've gotten a yes. It's almost a feeling of relief on behalf of that person. I think I would hazard to guess about 97% of the time I've gotten a yes. Because you're asking that question and you're being open to it, and they've probably never been asked this before. It's almost a moment of, oh my gosh, somebody gets it. Somebody recognizes it. And by using these words, they're going to talk to me about it. But all of these things that I'm actually feeling.
Well, and then you said earlier too, was that the majority of people don't want to die.
Definitely.
So this is their way of, okay, now maybe this person can help me because they're asking me about these things.
Most definitely, yep. Usually it's a moment of clarity and a moment of relief for them when they finally get to say, yes, I am thinking about suicide. Oh my gosh, you realized that this is what's on the table for me. I personally will be vulnerable enough to admit that I've been asked this question. And when I got to say yes, it felt like I really connected with that other person and they really saw what I was going through. That yes is why I'm here today. And I'm going to tell you that that yes will be the reason why the people you're working with will be here. But after they say yes, there's going to potentially be a moment where you're going to go, oh no, now what do I do? And that's an okay moment to have. That yes can be a scary thing. It's a helpful thing, but it can be scary. Know that you can do this. It's one of my favorite quotes about what we need to do next. If someone listens or stretches out a hand or whispers a kind word of encouragement or attempts to understand, extraordinary things begin to happen. And that's very true. That brings us to L. After we get that yes, our role is to listen. And how sad is it that it actually has to be a task within intervention? Listening, something that we should all be doing in the first place. But when we're listening, we need to understand why they're thinking about suicide. We need to be present with that person. We need to sit with them in this moment and listen to what they're saying. We need to truly hear what they have to say. So we're not texting on our phone. We're not watching TV. We're not thinking about the other 1,000 things we have to do. We need to be present and listening to that person as they talk. We can keep calm. I like how it says, we can keep calm. Perhaps. Remind yourself to keep calm. Find out why. You can ask them, like, what's happened? What brought you to this point? They might tell you. The key is really to listen, and then when you're done listening, listen some more. And then add some more listening on top of that. Your whole role at this point is to get them talking because they may not have ever had the chance to talk before about what's bothering them. You might know what's been happening for them and not realizing that it's bothering them to the extent that it does. You can listen to the reasons for dying, but in that, you're going to find things that might mean they want to live. You're going to find out what matters for them. What changes could they make to increase their life and decrease their suicidal thoughts? Validate. Say things like, that sounds really difficult. Sometimes being told that sounds really difficult can mean the world to somebody who has never been told that what they're going through is difficult. Ask questions. How are you feeling about that? Try to connect with their emotions. Express care and concern. How sad is it also that I have to put that on here? Sometimes though, when we start talking about suicide, we get lost in the nitty-gritty of ask the person the question and get them some help and blah, 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 blah. We forget to let them know that we care. So pausing at some point and saying, I really care about you and I'm glad you're talking to me can mean the world. Let them know help is available. Say something like, you may feel alone, but there are people who can help because there are. I'm going to tell you you're not helping when you're judgmental. You're not helpful when you don't take it seriously. A lot of individuals who experience suicidal thoughts over and over and over again are often not taken seriously the third, the fourth, the fifth time they start talking about it. But every threat, every time somebody's thinking about suicide needs to be taken as seriously as the first time. You're also not helpful when you tell them what to do. There's a difference between suggesting and telling. Suggesting would be something like, there's a group at the hospital that I know might help you. Telling them what to do would be, you're going to go to this group at the hospital and you're going to like it. There's a difference between that. Suggesting gives choice, and we want them to feel like they have choice. You're also not helpful when you tell them to do it. Ugh, that feels so bad inside. But yet there are individuals in this world who have lost their lives because people around them have encouraged them to die by suicide. There's a famous case in the United States where the girl is actually in jail right now because she convinced her boyfriend to kill himself. Don't ever call somebody's bluff. Don't ever tell them to do it. You're just confirming no one will miss them and we will lose them. The bottom one here is mostly for teenagers who like to keep secrets, who think that suicide and things related to mental health are things that can be kept secret. They can't. If you think somebody is at risk of suicide or is experiencing a mental health problem, you need to get that person help. We can't keep secrets. Your key messages are always just going to be, I care, you are important, I can help, there's help available, and there is hope. Building up the capacity for hope is something that we need to be doing with our people in our lives, regardless of whether or not they're thinking about suicide. But for individuals who are thinking about suicide, they are experiencing a severe lack of hope. Which brings us to our K. So after we listen, and listen, and then listen some more, and then stop and listen some more, we move into keep safe. We can perhaps assess their risk. Ask them if they have a plan, how and when they plan on dying. If they say, I'm going to go home right now and take all of the pills I have in my cabinet, perhaps keep that person closer. That tells us how immediate that need is. Have they attempted before? We can ask that question. If they've attempted before and they're still here now, what changed? What got them through last time? Maybe they have a doctor. Maybe they have a psychiatrist. Maybe they've been to 5 North. Maybe they know exactly what they need to do. They just need help doing it. Do they have a mental health concern? Really and honestly, whether or not somebody has a mental health concern is none of our business. But when we're talking about suicide, it can be helpful to know what supports are in place for that person already. So we don't need to necessarily know their diagnosis, but knowing that they have a psychiatrist or a counselor that they can call is helpful. So I always say when you're asking these questions, think to yourself why you need that information. Do you need it because you want to help? Or do you need it because you're nosy and you're curious and you just want to know? If your answer is, yes, I want to help, then ask the question. If the answer is, no, I just am curious, then don't ask that question. Figure out what you're going to do with the information you get. Find strengths. They might not be able to find any strengths, but as you're listening to them, some certain things are going to come out. You're going to learn who and what matters to them. You're going to learn, perhaps, what has been helpful in the past if they've been here before. You're also going to learn what are they good at. That will come out in their story through them telling you. You explore the way that they can make changes and alleviate a stressor. If one of the things that they're struggling with is job loss and they're not on EI or receiving any form of income, perhaps directing them to those places can help alleviate some of that stress. If they're struggling because they're a single parent and they have kids at home, perhaps helping them figure out babysitting or daycare can alleviate some of that stress. So take a look at the things that are stressing them out and see if you can help them or guide them to places that can help. Ultimately, you want to connect with supports. I love this little thing here. It's a lot to remember.
I'm sorry, with your last point there.
Yeah.
What if you get a person that you have that conversation and you kind of come up with some things that can be changed, but they just don't follow through with it because of their diagnosis. What is your role to step in? Like, how much do you step into?
Are we talking personal life or work life?
I'm talking personal life.
Okay. We also need to understand that just because we're taking on a caregiving role, that doesn't mean that they have no responsibilities. So we can encourage and support as much as we can, but at some point we need to perhaps back away and let them make their choices and just be there to support them when they need us. It can be the hardest thing to do to back away when we know that this will help, but we also need to take stock of our mental health and our capacity at the same time. Reaching out to additional services can be helpful as well, if there are any. I'm not too sure of the situation, but we can chat a little bit after if you'd like.
Okay.
And we can see if I can help you out a little bit more. But ultimately, we do need to remember that they have choices. We can't just take over their life, and we can't just force them to go anywhere we want them to go. And sometimes, yes, a diagnosis does make it hard for them to follow through with these things. But I would hope that for those people, there is also a different sort of support team set up with perhaps counseling, psychiatry, maybe a social services agency in place that can help that support. You need to connect with supports, figure out what's in the community. If somebody's thinking about suicide, we need to get them something in place. We cannot be the be-all, end-all for one person. When we talk about suicide, we always talk about a care team or a support team. Team is more than one person. So we need other people to come to the table to help us. Ultimately, if you cannot remember anything else, you need to get them to someone who can help. If you have almost a moment of, oh my gosh, I don't know what to do, forget all the rest and focus on getting them to help. It's one of my favorite TV shows of all time. And I love this quote, basically, because if a friend needs help, you help them. If you can't provide that help directly because of your capacity or your time, you just get them to somebody who can help. I also like to talk a little bit about what happens if you are the person having thoughts of suicide. If you're listening to this, either on the video or sitting in this room right now thinking that this is you I've been describing, know that you're not alone. There are 1 in 20 of us who are thinking about suicide. You're not alone. But I'm going to encourage you to reach out to your supports. Get help now. Right now. Pick up the phone and call. I'll give you some numbers at the end that you can call. It's also helpful to keep in mind that the happiest people are not those with the least problems, but those who have learned how to function in the world and cope with what the world can throw at us. So perhaps if you are struggling, work on building up your resiliency. On December 12th, was it?
The last one, I think so, yeah.
Yes, yeah, December 12th, I will be here. I, or somebody else from CMHA, will be here talking about coping and how to build resiliency and how to put those things into your life that will help you be well. You can create a safe plan as well. It doesn't have to be an elaborate plan. It might just contain some phone numbers that you can call when you're struggling. That can be a good enough safety plan. For the longest time, after the last time I thought about suicide, I carried around a slip of paper in my pocket that had the distress center line on it, because I knew that if I ever felt like that, I would have it in my pocket and I could make that call. Always remember that you're not alone. You're absolutely not alone. There is hope, and help is available. So remember, anyone can be at risk of suicide. Remember to take every threat seriously. Pay attention to walking with them. Your warning signs, ask, listen, keep safe. Know that your role in this is short term. It is focused support for that person until you get them to additional supports. Teamwork is necessary. Remember, we're talking about care team, not care person. If you need help, there are a wide variety of places that you can go. These are just some of the numbers. There's online chat, there is texting, there's our emergency services for education and support, which is CMHA's role. So we don't do any counseling, but if you were to call our office during office hours, we can help connect you to those people who can provide counseling or provide those emergency services. We also run the Hope and Healing Suicide Loss Support Group. The next one is starting in January. So if you want information about that group, it's a group for survivors of suicide loss, please give us a call at the office. Counseling and support. We always get people to go to the mental health community clinic, which is what we often get mistaken for. But that number is 403-529-3500. Or there's Medicine at Family Service, or there's a wide variety of private counselors if you have an EAP program. If you're in school, reach out to your counselors, your teachers, your family school liaison workers, your mental health capacity building teams. There's a whole bunch of places that you could reach out to. You need to pick which ones will work best for you and reach out when you need them. If you would like a printout of these, we have a When You Need Help poster available at CMHA. We also have little pocket cards that fold in half you can throw in your wallet. If you would like any of those, please feel free to contact our office at 504-1811 and we'll arrange a time for you to come in and pick them up, or we'll mail them out to you, depending on the situation with COVID. There's a lot of information I just crammed into your brains. And it's not all of the information about suicide that's available. CMHA offers many, many different workshops related to suicide. Basically, I say from birth until death, with a workshop, we've got you covered. So we have some half-day workshops like Tattered Teddies or Straight Talk, which tackles suicide in children and youth. We have Safe Talk, which is a half-day session on just suicide awareness and suicide preparedness. Then we have Assist, which is a full 2-day intervention skills training. I'm going to also urge you to keep your eyes on social media, on the CMHA social media, because we are working towards being able to offer some of our workshops for free to the community at this point in time. More details will be posted on our social media as soon as we have everything locked down. So if you just like us, you'll be able to find it when it comes out. If there are any questions, you are also welcome to contact me. I work Monday to Friday, 8 to 4:15, and I take a break for lunch from about 12 to 1. That's important information to have so that you know I'm not available all the time. I'm available through those hours, but you are welcome to call me at 504-1811, extension 102, or email me at my email address up there. Thank you so much for being vulnerable enough to sit here with me today and talk about suicide. It's really one of the most important things that we can talk about, and I'm actually very happy to see that you're all here or watching online. Thank you very much.